Hello, this is Sakshi, and I'm here to discuss an important topic from oral pathology, fibrous dysplasia. What is fibrous dysplasia? It is a disease of bone. It happens due to defect in osteoblastic differentiation and maturation. It is uncommon, non-hereditary disease. What exactly happens is जो हमारा bone होता है that is replaced by fibrous tissue, and this fibrous tissue is again replaced by secondary metaplastic bone formation. It happens due to somatic mutation in NAS1 gene. CNAS1 gene is present on chromosome 20. 20 is the number of chromosome. Q stands for the long arm. T is for short arm. And 13.2 is the specific region where the gene is present. NAS1 gene is responsible for activation of G protein. तो जब इसका म्यूटेशन होता है तो कंटिन्यूस एक्टिवेशन होता है जी प्रोटीन का which results in overproduction of CAMP. Now the CAMP is responsible for endocrine function, melanocyte activity and maturation of osteoblast. जब overproduction हो जाता है CAMP का तो ये तीनों में डिफेक्ट्स दिखने लगता है. Clinical features, age group 3 to 15 years affected रहता है with fibrous dysplasia. It is mainly of two types, polyostotic and monostotic. Polyostotic मतलब काफी सारे bones affected है in body. Monostotic मतलब single bone affected है. In polyostotic fibrous dysplasia, the bones affected are femur, tibia, pelvis, ribs, skull and facial bones, upper extremities, lumbar spine, clavicle, and cervical spine. It is in decreasing order of frequency. Okay, in monostotic fibrous dysplasia, it is more common, and rib, femur, tibia, craniofacial bone, and humerus are affected, again in decreasing order frequency. Main clinical features of fibrous dysplasia are bone pain, spontaneous fractures, bowing of long bones, leg length discrepancies, Shepherd crook appearance of long bones. You can see here Shepherd crook appearance of long bone. ठीक है, this is the pathognomic to the diagnosis of polyostotic fibrous dysplasia, and scoliosis occurs when the spine is affected. In monostotic fibrous dysplasia, when the craniofacial bone is affected, basically when the maxilla is affected, it gives typical leonine appearance. Now, in polyostotic fibrous dysplasia, हमने bone के defects देख लिए, ठीक है, maturation of osteoblast की वजह से जो हो रहा है. Now coming to cutaneous pigmentations, melanocytic activity में defect हुआ उसकी वजह से cutaneous pigmentations, उन्हें हम बोलते हैं caffeolate spots. And endocrine dysfunction जिसकी वजह से precocious puberty मतलब puberty hits छोटी एज में. और इसके साथ साथ हाइपरथायरॉयडिज्म, हाइपरकैल्सीमिया, एड्रिनल डिसऑर्डर्स, डायबिटीज, ये सब प्रॉब्लम्स देखने मिलती है. कैफेओलेट स्पॉट्स जो है दैट इज ऑल्सो सीन इन न्यूरोफाइब्रोमेटोसिस. न्यूरोफाइब्रोमेटोसिस में इनके स्मूथ बॉर्डर्स होते हैं एंड इट इज कॉल्ड कोस्ट ऑफ कैलिफोर्निया. और यहाँ पे इनके बॉर्डर्स इरेगुलर होते हैं, कोस्ट लाइन ऑफ मेन कहते हैं इन्हें. Now, there are three different syndromes. मैक्यून ऑलराइट सिंड्रोम, इसमें तीनों प्रेजेंट होता है, कैफे स्पॉट्स रहते हैं, एंडोक्राइन डिसफंक्शन रहता है और बोन डिफॉर्मिटीज रहती है. कमिंग टू जाफेज टाइप में देयर इज ओनली पॉलीऑस्टोटिक फाइब्रस डिस्प्लेसिया along with cafe olate spots. Let's see again here, polyostotic dysplasia with cafe olate spots with endocrine dysfunction. Japheth type, polyostotic fibrous dysplasia with cafe-olate spots. In Mazza-Brown syndrome, there is multiple intramuscular myxomas along with fibrous dysplasia. This is important. Multiple myxomas along with polyostotic fibrous dysplasia. There is one more type, Craniofacial fibrous dysplasia. In this, the craniofacial bones are affected, majorly the frontal bone, sphenoid, and maxilla. The clinical features can be headache or vital pain, blindness, hearing loss, and tinnitus. Coming to oral manifestations, when the jaw bones are affected, there can be pain, swelling, and deformity of affected jaw. ठीक है. जब मैंडिबल अफेक्टेड होता है तो देयर इज एन increased size or protuberant excrescence of inferior border of the mandible. और जब maxilla affected होता है तो maxilla के साथ साथ और भी facial bones affected होते हैं. Maxillary sinus, zygomatic process, floor of orbit, or it may even extend towards the base of the skull. There is a marked facial deformity seen. Now, radiographic features. Radiographic features, अब जो हमारा bone है that is replaced by fibrous tissue, तो radiolucent lesions देखने मिलते हैं. And this radiolucent lesion is surrounded by thick sclerotic border. This is the Rin sign. A radiolucent lesion surrounded by a thick sclerotic border. It is known as Rin sign. And ground glass appearance or orange peel appearance is the main feature. Coming to histological features, irregular C-shaped trabecular or woven bone can be seen. Early lesion में it is more fibrous and in advanced lesion fibrous tissue replace हो जाता है bone से तो bony trabecular दिखता है with characteristic Chinese letter pattern. Mononuclear cells देखने मिलते हैं and multiple delicate capillaries. Coming to treatment, there is no specific treatment for fibrous dysplasia. It is self-limiting. When the patient reaches puberty, it ceases to grow. But in monostotic fibrous dysplasia, cosmetic surgery can be taken into consideration. और विटामिन डी और बिस्फॉस्फोनेट थेरेपी हम दे सकते हैं पेशेंट्स को टू रिलीव बोन पेन एंड टू रिड्यूस ऑस्टियोक्लास्टिक एक्टिविटी. इसका प्रोग्नोसिस जब माजा ब्रॉड सिंड्रोम रहता है तो हायर रिस्क ऑफ मैलिग्नेंट ट्रांसफॉर्मेशन देखने मिलता है. इट कैन टर्न इनटू ऑस्टियोसार्कोमा, फाइब्रोसार्कोमा, कॉन्ड्रोसार्कोमा एंड मैलिग्नेंट फाइब्रस हिस्टोसाइटोमा. This is all about fibrous dysplasia. Thank you.